All right, what is up, everyone? It is Dr. Noah with the Source Chiropractic here in Dallas, Texas. I'm here with Malo today. We're going to be going through an adjustment, talking about what we're finding and what we're doing to create more ease, more function, and more life expression within the body. Malo was just talking to me, saying how she was experiencing a little bit of pain in her sacrum, which is this bone right in the middle of the pelvis, and how she's feeling a need for some stability. She was doing some foundation training, which was also helping, but we're gonna assess the body today and see what its needs are in terms of a chiropractic adjustment and how we can facilitate more stability within her low back and pelvis. So one of the main things that we do is a biotensegrity check here at the source. And so what I'm doing is I'm tractioning down on the heels, noticing where the body is holding compression and tension on the right side versus the left side. As I traction down on the left, it's moving pretty well throughout the entire spine. It is getting caught up here in the upper back area. Whenever I traction down on the right side, it's getting a little bit of a hiccup right here around the S2, S1 area into L5. One of the tests that I like to do whenever we have any sort of stability issues within our low back is a prone straight leg raise. All we do with this is I stabilize and have you keep this knee straight, lift the right leg up off the table as high as you can. Not too high on that right side. We're going to do the same thing on the left. Much better on that left side, so we know the right side is definitely our area that we're going to go into. I'm going to add more stability into her pelvis by pressing into these little bones called your greater trochanter. Go ahead and lift the right leg up again. And now we're getting a little bit higher. She will also mention how there was some pain there. Is there a little less pain with raising that right leg, Malu?
Yes.
Yes, all right. So we know we need to create some stability within the spine. One of the ways that I like to do that is by adding a compressive force, but we can also be super gentle with it by adding a drop. So we're gonna drop, pop up our table, and then adding that compression into our pelvis, and then adjusting right through that right hip joint, right sacroiliac joint. Beautiful. So now that we create a little bit of stability, we're going to see if there's a difference. Go ahead and raise the right leg again. Better. We're going to go ahead and lower that one. Go ahead and raise the left just to compare. We're getting closer and closer. We're going to move into more of an osseous adjustment. This is your typical chiropractic adjustment. Sometimes we call, it has a release, what we call a cavitation. What I'm going to have you do, Malo, is lay it with this side facing up. So even in an osseous adjustment, we're not just focusing on mobility, but also noticing where we can create stability within the spine as well too. So as we're feeding in, my focus is not going to be to move the SI joint, but to create neuroplasticity within her brain, within her body, where her body can become more aware of how to hold a more compressive or more stable pattern. With this, I sink into the SI joint. I'm also feeling like it needs a little bit of extension just in the sacrum, not into the lumbars, as we don't want to compress those more. I'm going to roll towards me and drop right through. Go ahead and go face down again. All right, we'll recheck our test just like before. Go ahead and raise the right leg again. Much higher. Go ahead and raise the left. Beautiful. How's that feeling?
Oh, so much better.
Awesome. She said so much better if you didn't hear. We're going to check our biotensegrity again. Right side is clear. I'm still noticing that little hiccup right here in the left rib cage, upper back area. Malu is also a student, which we tend to hold a lot of compressive forces, a lot of tension within our neck whenever we're studying a lot, preparing for our exams. Just discovering what exactly her body needs, and I'm noticing she unwinds more with a torquing of the tissues in this direction. So I'm not just adjusting the single vertebrae, but seeing how I can incorporate her entire body into this adjustment. And I sink with that torque. Go ahead and lift your head just a little bit, and then let it fall towards the right. Right there. Beautiful. Deep breath in. An adjustment is like an external force. Your breath is an internal force. And so that's something that we tend to use within our adjustments to to help create more ease, but also teach your body how to adjust itself so it can begin to unwind its patterns, not just in the office, but outside of the office as well. The tone of that tissue has decreased a good amount, noticing more fluidity within the entire spine. Go ahead and flip onto your back, face up for me. And we'll check the cervicals. Haven't had a chance to check these out yet. Our focus is the low back, but everything is connected within the body, and so we want to make sure it's all moving super well. I'm noticing at C3 on the right side, the third vertebrae from the base of the skull, or the third bone, is a little bit restricted on the right side on the back part of the neck. And then coming to the front, noticing the anterior, because you are a three-dimensional human, you have a front part of the body that needs to be adjusted as well too. I'm noticing something right at the lower part of the neck into the scalenes muscles. These tend to get really tight if we're doing any computer work, looking at a book, looking down at our necks as well too. Super important in today's society. We're going to clear out the C3. This is a unilateral facet adjustment. Perfect. And then coming back to that anterior in the front, we're going to do this in a push application. So sinking into the anterior, helping bring any anterior head carriage backwards so we can begin to stack our volume, stack our ears over our shoulders, shoulders over our hips, hips over our ankles. And so a light touch. This is also a sensitive area, so we move with lots of intention and purpose and focus. Perfect, with a deep breath of integration. When we're doing an adjustment, we want to see that it's affecting our entire being, not just on a musculoskeletal level, but a physiological as well. And our breath is a great indicator that an adjustment made an impact into the system. When we take a deep breath, when we begin to relax into our bodies. Also noticing a little bit of restriction and dorsiflexion of our left ankle. I tend to notice that left lower extremity tends to go into the right SI joint as well too. So this might be a contributor to the low back, it might not, but we're just gonna go ahead and clear it anyways. Awesome. Beautiful. And we're all set. You can come on up.
Thank you so much.
Of course. How'd that feel if you want to turn around?
Wow. Absolutely needed it, and I feel rejuvenated, but I feel more alive in those areas that just needed a little bit more attention.
Oh, beautiful.
Thank you.
Of course.